Hello everyone, I hope you really enjoyed my last video about improving posture, and through popular demand, today's video is delving a little bit further into detail about addressing postural dysfunction and issues regarding office syndrome. I know a lot of you are working from home right now and may be suffering from potentially neck or upper back pain. And a lot of this, again, is related to that forward head, rounded shoulders position I was discussing in the previous video. But today I'm going to dive a little bit further into the depths of how to stabilize your neck and how to improve the flexibility of your neck and upper shoulders to have further improvement in this realm of care. So first to begin, what is office syndrome? It's an issue that's characterized by repetitive long-term stress, most commonly, for example, on a computer, and the associated rounded shoulders, forward head position that goes along with it, which places a great deal of stress on our neck, on our shoulders, and on our upper back, which results in inflammation and associated pain. How do we stabilize the neck? Well, the neck is stabilized by deep muscles in the back of the neck called our local stabilizing musculature. And the purpose of these muscles is to stabilize the neck and prevent that forward head position. The way we improve the strength of this muscle group is by doing what's called a chin tuck. So the key to doing a proper chin tuck is to keep your eyes forward and not allow your eyes to come down. Remember again that forward head position is the cause of a lot of issues in the neck and the shoulders, so trying to keep one's head up throughout the day is another really critically important part of improving the neck and shoulder issues. Now again, notice that I'm not bringing the head forward. I'm instead trying to tuck the chin down and back. How do we perform flexibility exercises for the neck and the upper back and shoulders that will help with issues regarding office syndrome? So there are 3 stretches to learn today. The first stretch addresses the scalenes in the front of the neck, which assist with inspiration and flexion. And how they can be stretched is by hand over hand, slightly below the clavicle, and moving the head opposite and away in a diagonal movement, holding for 30 seconds, then coming back to neutral, switching the hands over, tacking down, opposite and away again for 30 seconds. The second stretch is for the upper trapezius muscle group. A lot of you may know this because it's where we hold a lot of our tension, most of us. And to stretch out this muscle group, first we place one hand behind our back, the other hand goes behind the head, and you want to pull diagonally down towards your armpit, again for that 30-second hold, at a moderate intensity at the most. After you've held 30 seconds, I would recommend pushing yourself out of that position before you switch the other hand behind your back, the other hand overhead, and again pulling diagonally and down forward to the other side. The final stretch of today's lesson regards the levator scapulae, which is a muscle group which helps to elevate the scapula, hence the name. And it's very similar to the upper trapezius stretch. However, instead of the first hand going behind your back, it goes up and over your shoulder. Then the other hand will come over the head, and again pulling diagonally down towards that armpit. You should feel that a little bit higher up in the shoulder. Then pushing yourself out of that position, switching your hand over to the other side, and pulling down to the other side for 30 seconds. So in terms of dosage of these exercises, for the chin tucks, I would recommend 15 repetitions, 2 sets, 3 times a day. I'd recommend, like I mentioned in my previous video, to make it part of a resting break, especially if you're working on a computer throughout the day. Every hour would be the best, but at least every 2 hours. With any of these exercises, I want you to stop, contact a local physical therapist, and make yourself an appointment. You're going to achieve much faster results and learn a great deal more by seeing a therapist in person. This video has all been about improving one's ability to deal with issues relating to office syndrome and that forward head, rounded shoulders position. But again, there are so many different topics I could post about. A lot of that just depends on what you'd like to see. So if you have any ideas or any topics you'd like me to cover, please post your comments below, and I'll get to that as soon as I can. Some of you already have, and I'm currently in the process of working those, and thank you for those comments. This is Dr. John Mayo, physical therapist, saying I hope this is very, very helpful, and I hope it helps to improve your life or the quality of life for someone that you love.